1 in 8 Americans over the age of 12 have hearing loss. Tinnitus, or a buzzing, humming, hissing, or ringing in the ears, is experienced by 1 in 10, and dizziness and vertigo affects 1 in 5 annually. I'm Doctor of Audiology Brennan Walter with Salina Regional ENT and Audiology.
Well, Doctor, thank you so much for coming on the show. We're going to be talking about audiology. So why don't you tell us what an audiologist does?
Well, thanks for having me on. At the core, an audiologist is a diagnostician within the auditory and vestibular systems. So with the auditory system, people will usually come in complaining of hearing loss. So we then systematically test the system to see if there is hearing loss, and if there is, what part of the system is it in. So the ENT team may use this information to diagnose a medical condition and treat it with medications or surgery. If it's not due to a medical reason and the person's quality of life is being affected by the hearing loss, then hearing aids are the recommendation, and those are fit with audiologists. With the vestibular system, patients are referred to us because they're experiencing vertigo. Vertigo is the illusion of motion and can look many different ways. So again, we go through the system from the reflexes in the inner ear, there's end organs, up to the parts of the brain that mediate them, that keep us upright, tell us up from down, keep our eyes on a target while our head's moving. And based on these results, you might work with a physical therapist or an occupational therapist, or have a medical condition treated by a physician. Audiologists also program cochlear implants, diagnose central auditory processing disorders, manage decreased sound tolerance and tinnitus, protect workers who work around a lot of loud noise from noise-induced hearing loss, work with the pediatric population. So Salina Regional ENT and Audiology consists of 2 otolaryngologists, or ear, nose, and throat physicians, a physician's assistant who specializes in otolaryngology, and 2 audiologists.
When should somebody come see you?
If you're noticing difficulty with one-on-one conversation like this, conversation in the presence of background noise, so at restaurants or bars, if you have trouble hearing on the phone or the TV, if you have a bothersome ringing in your ears or humming, buzzing, hissing, if you work around a lot of loud noise or have loud hobbies, or you're dizzy, you should discuss with your primary care provider if an audiology referral is appropriate.
Okay, thank you so much for some great information. And thank you for watching. For more information, please visit SalinaRegionalENTandAudiology.com.